Welcome committee.
Thank you, Chair, and good morning, committee. I am Amanda Prosser, as the Chair stated. I am with Legislative Research, and I'm the fiscal analyst tasked with bringing everyone up to speed on how the budget for Department for Children and Families is contained within the House Budget Bill. The main document I'm going to reference is that budget summary, which is in Volume 2, page 282 in your notebooks. I'll also be referencing the yellow Governor's Difference document and the green House shorthand, page 12. And thankfully for all of us, we have some fantastic, smart individuals behind me from DCF, including Secretary Laura Howard, Deputy Secretary Dan Lewin, Deputy Secretary Tanya Keys is not here, I don't think, and Budget Director Tammy Tompkins. After I present this budget recap, they're all more than willing to answer any questions that you may have. So looking at that budget summary, again, page 282, beginning with that front table. Quick reminder that we have actuals for fiscal year 24. We have the agency's revised request for the current year, fiscal year 25. We have the fiscal year 2025 budget recommendation from the Special Committee on Legislative Budget that met in December, the agency's request for fiscal year 26, and the fiscal 26 budget recommendation from that special committee. At the bottom of the page, you'll see a bulleted list of the broad budgetary programs within DCF. But if you flip forward to page 283, we're going to discuss the current year analysis. Looking at that second box, figure 3, you can see that the agency's revised request for fiscal year 25 was $1.1 billion, including just under $494 million in state general fund. Looking at the gray boxes to the right in that table, you can see that the agency's revised request as far as SGF spend goes is about 20% above the 2024 actuals and about 1.5% below what they were approved for. This percentage increase over last year's actuals is to be expected somewhat because it includes what the legislature appropriated for the agency last session. And I know the committee has a long day, so I won't list those items just yet, but if you want to recap, I'm happy to go through them after. The third table on the page, figure 4, shows a bit more detail for the current year. Here you can see that in addition to what was appropriated for fiscal year 25, line 1 shows that $30.8 million of unspent funds in 24 was reappropriated as required by law into fiscal year 25. And on the right side of the table, you can see those dashes. Those dashes are showing that at the request of the Special Committee on Legislative Budget that met in December, all SGF reappropriations were to be reviewed by the chair and then lapsed. Now, I will say prior to that motion being made, the agency did provide a list of what the initial game plan was for those reappropriations, and that's the final page in the budget summary. I'm not going to spend a lot of time covering that now because in light of the legislature removing those, I imagine Secretary Howard will come and speak to that after. Moving down the table, item 2, you can see that the agency didn't have any supplemental requests in the current year. Item 3 is showing that when the agency initially submitted their budget, they preemptively lapsed about $7 million of their reappropriations prior to the LBC motion. So earlier when I was recapping the legislative committee lapsing those reappropriations, the LBC motion did just effectively lapse the remaining reappropriations. Subsequent items in that table, items 4 through 10, these are the various federal funds with no limits that the agency has the statutory authority to spend. Really what you're seeing here is a timing thing. So when the agency submitted their budget for fiscal year 25 initially, that was all the way back in September of 23. And at that time, when they make their best guess on the amount of federal dollars coming in, there's an appropriations bill that's passed by this body in the spring of 24. Then if you move forward even more to last September, September of 24, that's when they have a better understanding of how much federal dollars are coming in and what their budget's going to look like in the current year. And so what you're seeing in lines 4 through 10 is the agency anticipating receiving more federal funds now in this current year. Of course, the committee is more than welcome to read through the pages in the budget summary that give kind of a high-level view of each of those items. But that being said, if you have a pen handy, you might circle item 4 in that list. So item 4 is the summer EBT benefits, and I'm going to come back to that one in a minute. But staying in this figure 4, the last item you see is the fall human services caseload. This refers to the consensus process that occurs, in this case, between Division of Budget, Children and Families, and Legislative Research. And that's when the 3 agencies come together with our own analysis to estimate the cost of what you might think of as entitlement programs. Certainly happy to talk more offline about what that process looks like, but through that process is where we come to an agreement on how much cash assistance the state can anticipate paying for temporary assistance for needy families, for TANF. And we also look at what the state spend is for foster care, and that of course includes the contracts that the state has with the case management providers. And so here in line 11, what you're seeing is that when the group met in the fall after the budget was submitted, the group came to a consensus that there was a reduction in some federal funds that were anticipated. And so we needed there needed to be about $3 million more SGF for that purpose. Okay, now I'm going to switch documents and talk about how the current year, the one that we're in, is reflected in the current House budget bill. If you look at the green sheet, page 12, you'll see 3 items kind of in the middle of the page that are beneath the heading for Department for Children and Families. These are 3 motions that were made by House Appropriations to amend the original House Bill 2007 that was introduced. Those 3 items are, number 1, add 997,000 some SGF to fully adopt the full human services caseload estimate in the current year. And then items 2 and 3 on that list are tied to that summer EBT program, which was something I asked you might circle back in the budget summary. So the summer EBT program, as you may know, it's the Sunbucks program. This is the program that's looking to replace a pandemic era program where families were provided with an EBT card to be used on food for when schools and childcare facilities were closed during COVID. The current program is the Sunbucks Summer EBT program, and that's administered through the USDA, Department of Ag, and provides $120 per summer to kids who qualify. These benefits to kids are entirely federal dollars, which is what you circled on the budget summary, item 4. As for the administrative piece of the program, that's a 50-50 match between the state and federal government. Originally, the agency was using reappropriated dollars to fund that administrative cost. And then you'll see in the budget year analysis for 26, the agency will come back and ask for an enhancement that would demonstrate the state's commitment to pay the SGF for that administrative cost rather than using reappropriations. But as I stated earlier, all the reappropriations were lapsed. So now on this green sheet, what you're seeing is that the House, what they ultimately did with this item was to appropriate the SGF administrative cost portion to State Finance Council, and then added language requiring that the funds would be released to DCF upon certification of the Secretary, that a waiver was submitted to the feds asking for an exemption on candy and soda from the eligible foods list for those EBT purchases. And then item 3 on the green sheet, you can see that the House added language that they wanted to lapse any unspent administrative cost for that summer EBT program in 25. And Chair, that brings us through the current year. I can stand for questions or move on to fiscal year 26.
Any questions on 25? Senator Petty.
Thanks, Mr. Chairman. So on the EBT program, when I'm looking on the green sheet in year 25, so there are conditions there for the department to submit to ask for a waiver for those items that actually, there's currently a bill, I know at least one bill out there dealing with that very issue. And so it deals with applying for the waiver, and then those funds would be released. And then does number 3 then that pertains to any unspent funds from 25?
Chair, item 3 is going to be tied to item 2, and it's just the idea that any monies that they do get appropriated, anything that is unspent would lapse.
And the money that we're talking about is for administration.
Correct.
Is that correct? Thanks.
Other questions? Seeing none, please proceed.
Okay, now we're going to go back to the budget summary document. You're going to flip forward, if you would, to page 287. That's going to start the budget year analysis. Again, looking at figure 6, you can see that the agency's request for 26 is just over $1 billion. Excluding reappropriations, which were lapsed, that's about a 1.6% increase above the approved amount, and that's primarily all in enhancements. So if you look down now at figure 7, you can see the top line showing what the body appropriated for fiscal year 25. These numbers that you're seeing do not include reappropriations. And then items 1 through 12 list out the various enhancement requests that the agency provided in September when they submitted their revised budget. All of the dashes on the right side of the table indicate that the Special Committee on Legislative Budget did not fund any of those enhancements on their initial introduce of House Bill 2007. And of course, that was a part of the global motion to delete all enhancements. Now again, if you have a pen handy, I would circle items 1 through 5 in this list and maybe write a G next to them. All of those items 1 through 5, were all included in the governor's proposal, and you will see them on the yellow sheet that talks about the governor's differences. Then, if you want to make an asterisk next to items 1 and 5. So item 1 is the only item in this list of enhancements that was included in the House budget bill. As I mentioned earlier, this is where the agency is requesting the state commitment to fund 50% of the total administrative portion for the summer EBT Sunbucks program. And something to note is that SGF amount you see of $925,000, this includes an extra $100,000 state general fund, because in addition to the cost of administering the program, the agency would like to set aside $100,000 to reimburse individuals who experience fraudulent transactions. So by fraud, I mean, think of your bank statement and seeing a charge out in California when you haven't been out to California. The federal government does provide the dollars for all of the benefits, except for those that have been identified as a fraudulent transaction on the debit card. So there's an extra $100,000 in that $925,000 that would cover those cases. And again, similar to the previous year, it'll be noted on the green sheet, this money is going to be held at State Finance Council until a secretary can demonstrate that she's applied for the waiver to seek exemptions from pop and candy. You also made an asterisk, I hope, to item 5. Item 5 is for the software licenses. The agency uses a program called Current. This is actually something that's used by KDHE to manage their Medicaid caseload, and DCF is working towards integrating it into it's called the KEYS system. It's the Kansas Eligibility Enforcement System. And so they're looking to purchase software licenses to get all that together. The reason you put an asterisk there is because in the House budget bill, the SGF portion of this particular item was paid for using ARPA interest. However, in light of motions made last week, that item is not in the Senate version of sub for House Bill 2007. Now, I'm not going to talk through the rest of the enhancements. I know we're on a tight time schedule. The budget summary includes some detail on each one, and certainly if the secretary is interested in any of them in particular, she might mention them in her testimony. But again, the takeaway is to circle items 1 through 5, as these were all included in the governor's proposal. Put an asterisk next to item 1, because that is in House Bill 2007, and then maybe an asterisk in ARPA next to item 5 for the ARPA interest piece. Now, if you'll pull out your green sheet again, going to go back to that. And this is where I'm going to talk about what additional items above and beyond that were added to the House budget bill that were not a part of the agency's request or the original special legislative budget bill proposal. So on the green sheet, page 12 at the bottom of the page, we're looking at the list that's beneath the fiscal 2026 header. The first item I covered, that's the summer EBT stuff. The second and third items are ones that were added after public testimony was provided. Item 2 on the green sheet is adding $600,000 state general fund for Envision to provide home-based services to individuals of all ages who are blind or low vision. Item 3 is adding $215,000 state general fund, again, one-time funding to operate a pilot project with the Cerebral Palsy Research Foundation. Item 4, I've already talked about. Flipping over, item 5 in that list is adding some TANF expenditures for the Kansas Big Brothers Big Sisters. Item 6 is what I described earlier with the software licensing. So here you're seeing a 0 on the state general fund because it was going to be paid for with ARPA interest. And item 7, I believe Dayton mentioned yesterday. This references a motion that came from HAP to add language requiring the agency to share eligibility information for program participants with KDHE to help identify fraud in various programs. Item 8, already touched on. And then item 9. So item 9, this is in reference to something that was passed last year. Last year, it was decided to use the Children's Initiative Fund dollars to support a child care workforce registry that was developed in years prior with pandemic dollars. Since then, the Children's Cabinet has raised some flags on the balance of that fund, the key fund, and has asked that this particular item not be funded with CIF dollars, but rather state general fund dollars if the state chooses to continue that. So what you're seeing on the green sheet here is the deletion of the CIF funding for this item. And then at this time, no state general fund has been appropriated to continue that registry. Lastly, in the green document, if you flip forward, I think it's page 31, I'll note that the agency was impacted by the 3 other global motions that were made in House appropriations. So this will include the 1.5% cut that will be on an agency's total fiscal 26 amount. For this, the agency would take the 1.5% cut on their approved amount of expenditures, which would include their initial appropriation for 26 and the amount that would reappropriate from 25 into 26. The next global motion to occur would be the cut of SGF funding for vacant positions. With this cut, the agencies would have until July 15th, I think, to appeal before State Finance Council would officially certify that cut. I would note in this budget bill, sub for House Bill 2007, this language is different than what is floating around in Senate Bill 99. I think it's Senate Bill 99. So Senate Bill 99 is the policy bill which seeks to accomplish a similar idea. However, in the Senate Bill 99, the cuts are based on a position being vacant for 180 days, and that is slightly different than what's in the appropriations bill. The one last piece I hope to review before there's questions is going to be back on this yellow sheet. The yellow sheet, again, is going to cover things that were in the governor's proposal that were not in the original introduction of House Bill 2007. And there is a couple things that I just want to make sure we're all on the same page with. So items 1 through 5 on your yellow sheet, and item that's a different yellow sheet. Sorry, I'm going to address how the governor's proposal added the specific enhancements that the LBC deleted. The rest of the items are new items in the governor's proposal that have not been included anywhere else. I don't have a lot of information other than what was in the governor's budget report. So one of those items is to add funding to reduce family co-payments for child care assistance. This would allow co-payments to be waived for families at 150% of the federal poverty level. Another item was the workforce registry that I mentioned earlier. The governor is proposing to use state general fund dollars instead of CIF for that. Another item in that list looks to establish 11, 12 behavioral health intervention teams within the current case management providers, and they would serve youth with significant behavioral health challenges and are experiencing those night-to-night placements. There's another item in that list that would allow full pass-through of state-collected child support to families for 26. This would mean families could receive child support without it affecting their TANF eligibility. Item 10, or another item on there, would fund a policy change that would allow discretion in issuing child support orders in sync cases. And then there's another item that ties to the governor's. Aha, this is the one I needed. There we go. Sorry, item 11 ties to the governor's executive order. Secretary Howard can give a great history on this, but what this added funding would do is allow federal SSI disability and SSA survivor benefits to remain with the child in an ABLE account. So previously, those funds would have been counted as assets when qualifying for various assistance programs. And so to not lose those dollars, states across the country, not just Kansas, would use those disability and survivor benefits to offset the cost of foster care. Now we have the ABLE accounts, and that money can stay with the child and not impact their applications for other assistance programs. But that means that the state will need about an estimated $8 million state general fund dollars to cover the foster care cost now that we're not using those funds. Item 12 is modifying language and is tied to item 10. Again, it's related funding a policy change. Her proposal would have added modifying language to require sync cases that are seeking child support where appropriate, rather than automatically referring them for child support. And then item 13 on the yellow sheet, we've already talked about. And so if you're still like me and have your pen and want to circle things, if you circled 1, 4, and 13 on the yellow sheet, those are the ones that are included in some format in House Bill 2007, sub 4 House Bill 2007. And Chair, that covers everything I was going to touch on. I can happily stand for questions.
Thank you. Questions? Senator Petty.
Thank you. You did a great job in this. I just wanted to make sure you really were concise about the House things. So as far as ARPA funds, there was only one item that was impacted by the ARPA funds?
Chair, that's correct.
Thank you.
Other questions? Senator Fagg.
Thank you, Mr. Chairman. Thank you for your presentation. On the summer EBT fraud reimbursement, you went over that 2 or 3 times. Can you give me an example of how fraud would happen with that? Is that somebody took somebody else's card and did that, or trying to understand what that is?
Sure, Chair. I'm sure the agency can give more examples, but that EBT card is a debit card like we're used to seeing. And just in the same way that my card, I might use it to purchase something and then there's a skimmer and that number gets taken, I don't really know how. But I'll look at my bank statement and all of a sudden see charges in Louisiana that I didn't authorize. And I have no idea how that happened. We would be able to call our banks and say, that was not me, and the bank would reimburse us. With the summer EBT program, it's a little bit different. That charge that happens, they will see on their statements that there was a fraudulent charge out in Louisiana that they didn't authorize. But the federal government is not going to reimburse that family or that child for those dollars that were lost. And so what DCF is asking for is we want to set aside $100,000 for cases where that's identified and has happened so that we can reimburse that child for that money that was lost. Does that make sense?
That does. I'm just tying back to the bank side of it, because usually they cover, you know, up to $50. I mean, anything over 50. So that's covered in the banking deal. So on that side of it, you're saying the federal government is not going to back that up, is what you're saying. Thank you.
Other questions? Senator Alley.
Thank you, Mr. Chair. So how much was on that EBT card for the summer? How much is that per month? Or do they get it funded by month, or that EBT card is fully funded for the summer?
Chair, I'm going to turn slightly to make sure. It's $120, correct? For the whole summer, which covers 3 months, $40 a month.
So if my math is right, we take it, let me make sure I get this right. If we take $100,000 and we divide that by 120, that means we have 833, we'd have up to 833 instances of fraud on our cards. Is that possible?
If your calculator says so, then it might be. But I can't speak more to that, but certainly I'm sure the agency could come and talk a little bit more to it.
I'm just guessing, I mean, do we have that example that we had it last year of that much fraud? That's what I'm asking. I mean, are we,
Chair, we do have a fraud report that we can provide you if the secretary doesn't address that in her testimony.
thank you.
Senator Fag.
Thank you, Mr. Chairman. I want to talk just a little bit on number 11, replace SSA, SSI collections for foster care children. So as you read that sentence there, they would be getting their disability and survivor checks, but we're not using those checks. We're putting them into an account, and then they want the state to pay that. Explain what's happening in that area for me a little bit.
Sure. Chair, so my understanding with that is initially states, children across the country were receiving those benefits, but if they were to go directly to the child, then their assets would be too great to qualify for any other assistance programs, Medicaid, anything. And so previously, what states were doing were using those dollars to help offset the cost of foster care. Now we have what are called those ABLE accounts. And so those ABLE accounts are exempt, my understanding, for various federal assistance programs. So those dollars that they're receiving in survivor benefits and disability benefits can go in that ABLE account and not be counted against them. And so that money gets to actually stay with the child for them to use for the purpose it was initially intended for. But because of that, we're no longer using those dollars to help fund foster care in a state. And so we have to figure out a way to pay for that in some way. And so this is DCF coming and asking for about $8 million to help offset those costs.
Other questions? Seeing none, Amanda, thank you. Good job. Next, we'll have the agency presentation with Secretary Laura Howard. Secretary, welcome committee.
Thank you, Mr. Chairman. Laura Howard, Secretary for Department for Children and Families. I'm glad to be back with you today. You have a deck in front of us. I won't go through every page in this deck in the interest of time, but I just want to highlight just a handful of priorities and then answer the committee's questions. If you start on the second page of the deck, you just see sort of a quick comparison of the 2025 governor's budget recommendation to House Bill 2007. And I think your staff did a great job of going over that. You know, as was indicated earlier, in the current year, the administrative costs for summer EBT were funded by the House, and we're grateful for that and would ask you to retain that. I also, though, wanted to talk to you about a handful of other priorities in 2025, starting on page 3. You know, during the staff review, you know, it was mentioned that when we submitted our budget, our revised budget for fiscal year 25, DCF kind of voluntarily lapsed about $7 million that had been unspent, but then we had additional funds that had been reappropriated, that had been previously approved, that we had committed for specific projects. You know, on page 3 of my testimony, you can see in total, that's about $20.9 million in state general fund dollars. I'm here today asking you to restore 20% of that. The top part of the page, $4.7 million. This is funding, again, that had been previously approved and committed for a vocational rehabilitation IT project, for a number of contracts and grants, and you can see the details on the way in which we've used that funding, but I think the main point I want to say to you today is that this funding was previously approved, we carried it over, and we're spending that resource. So again, I'm on the top of page 3, I'm on slide 3 in the testimony, slide 3. And then have some detail on the next slides that give you some details on each of those. And I won't go through each of those items, but for example, the first one, just as one example, would be funding for a new system that we're working on for our vocational rehabilitation program called the ks program. And so of these reappropriations, I'm asking to be restored, about $850,000 relates to that project. And that project is just taking a little bit longer than anticipated. anticipated. You'll also see in the next slides that follow some other increases in fees, contracts, leases, some changes in federal match and the way some of our cost allocation goes. But again, these are all contracts in place, costs we've already incurred. So without the funding being restored, we would have to cancel contracts, delay payments, or increase our shrinkage, really kind of freeze our hiring. So again, I'm not asking that the full amount of the reappropriation be restored, but just 20% of it, $4.75 million. And that's really the only ask we have in the current year. And so I would just ask the committee to consider that. I would then move you all the way to slide 10, which would go into fiscal year 26. And I think, again, your staff did a great job of talking about some of the adjustments that were added into the budget that weren't as part of the governor's budget recommendation on the House side. And those are listed on the bottom of the chart on page 10, starting with the pilot, Gila Life Skills, the home-based VR. I mean, that listing there, as well as some of the across-the-board pieces. I'm not really going to speak to any of those items. Again, those were decisions the House made that weren't in the governor's budget recommendation. But I would ask you to consider two items that had been in the governor's budget recommendation that the House did not choose to fund. And I'll be on slide 11. So again, what was included by the House in the budget that the governor had also recommended was, again, the summer EBT program, as well as the workload management software licenses we talked about, really allowing us to use this current software similar to KDHE. Now, I want to mention that one. The House did fund that, but again, as was said earlier, that was funded from the ARPA interest dollars. So your global actions a few days ago took that out. So I would ask you to take a look at that and perhaps restore that from the state general fund portion of that so we could move forward with that. I think really have a significant impact on our ability to more effectively and efficiently serve clients in our local offices in a timely manner. And then I have two of the enhancements that the governor had funded that I would like this committee to consider. And those are in the middle of slide 11. And I'll talk about each of those, ending the use of children's federal benefits to fund foster care and the behavioral health intervention program. We've also listed the other GBR enhancements that we initially requested that were not funded by the House. I'm not asking you to restore those, but some of you may have interest in some of those, so I have information here about those. But I wanted to talk about those two items. The first does have to do with the governor's executive order that would end the use of children's federal benefits to fund foster care. The governor signed an executive order that would direct that DCF preserve and conserve federal benefits for eligible youth in care. And just a little bit of history on this. You heard a little bit in your staff presentation. But for many years, folks getting federal benefits like SSI or other benefits like Medicaid could only have a very limited amount of assets. So if you exceeded $2,000 in assets, you really were disqualified from those federal benefits. So you would jeopardize the SSI or the SSDI, jeopardize the ability to apply for other benefits. So as a result, eligible youth in care who qualified for those benefits, states help children to qualify for those benefits, but then use those benefits to offset the cost of foster care because there wasn't any way to preserve or conserve them based on the rules that were in effect at that time. A few years ago, federally, the concept of ABLE accounts was introduced, which would allow the opportunity for funds to be set aside in a preserved account and used for, certain primarily disability-related expenses. The state of Kansas was an early adopter of that as well. You've passed ABLE legislation as a state a few years ago, and some follow-up legislation after that. So what the governor's executive order does is direct DCF, instead of using that funding to offset the costs of foster care, to preserve that funding in accounts for children. And think about a child aging out of foster care who has disabilities. These are really funds that these children qualify, because of a disability or because of the death of a parent through SSI or SSDI. And so that child then coming out of care would have access to those resources, could make a big difference in the ability to, housing, education, healthcare, or the like. Maybe even preserve the likelihood that the child would need to rely on other state or federal assistance. So again, that's what the executive order does. The funding impact of that would require an additional $8 million to make up for those costs that we have been using in foster care. It's about 13% of the youth in foster care who get these federal benefits. And so again, this has been a change in policy that states have been putting into place over the last few years. As of last December, 29 states had pursued this action in some form. So again, that's the first item I would ask you to consider. That executive order is in place. We're moving forward with it. It has a lot of provisions in it too. For example, it has some provisions in it where we're working on a work team with the state treasurer's office who is in charge of the ABLE accounts for the state to develop some very targeted, financial management training related to using those accounts appropriately and things like that. So a lot of safeguards in place as we would move that forward. That's the first item. The second item I would like you to consider in terms of enhancements is on slide 13, behavioral health intervention for placement stability in foster care. This funding would provide for 8 behavioral health intervention teams to serve youth who are experiencing frequent placement disruptions. We were able to fund 3.5 teams kind of on a pilot basis in the current year and are seeing good results from those. This is, most kids who are in our foster care system are in stable placements. They're not moving around a lot, but we have a small cohort of youth, some with some criminogenic behavior, some with high intensity mental health needs, who are having a lot of placement instability. And this is a strategy to impact that with those youth. We would have specialized case manager teams with our case management providers, a 1-to-5 caseload ratios. There would be both case managers and in-home behavioral interventionists that would spend significantly additional time with the youth, with the foster parents, or wherever that child is living to really help to get to long-term stable placement. So again, I think this is important both for those youth. I think it's also important from my perspective as I think about the class action lawsuit that we're under as a state, and the issue of placement stability is a significant issue in that litigation. There were a number of other enhancements that weren't funded that we've give you information on in the slides that follow, but again, I'm not specifically asking you to restore those. So in summary, I would actually move you all the way back to the very last page of the document, and I think this is also a document I've shared with a number of you. Just in summary, in terms of my request to this committee would be for fiscal year 25, in the fiscal year 25 summary, we would ask you to restore of the items in orange at the bottom of that page, 4.7 million of the reappropriation, 20% of the lapsed reappropriation for costs that have already been incurred and are committed. And then in fiscal year 26, I would ask you to restore funding on the top of the page, the workload management software that the House funded with ARPA interest. I would ask you to restore the SGF to allow us to move forward with that, and then to fund just the top 2 priorities in terms of the enhancements related to the executive order, related to the federal benefits in foster care, and the behavioral health interventionists. So those are my requests, Mr. Chairman. Again, the reappropriation in the current year, 2 enhancements, as well as restoring some state funds for the ARPA interest dollars on the workload management. I'd be happy to answer any questions.
Thank you. Questions? Senator Fagg.
Thank you, Mr. Chairman. I'm still hanging around this 8 million that we're talking about. When was that executive order done?
The executive order was issued in December.
In December? Okay.
Yeah, December 24. Actually, I take that back. It was early January. I think it was initially scheduled in December, but it's actually signed in early January.
So the federal money that comes in, isn't that for the care of these kids?
The states, including Kansas, have used it for the care of the kids. What the federal money that comes in, though, are disability benefits or survivor benefits that those youth are entitled to, whether they were in foster care or not. If they're a youth who has lost a parent and they qualify for survivor benefits, or if the child has a disability, those are benefits that they're not tied to foster care. I mean, what states had done, including Kansas, was kind of optimize our revenue by kind of taking those benefits and using them to offset the cost of care. I mean, what this would say is, let's preserve those benefits for those youth, so they can carry those into their adulthood.
We know how much money for an average person that would be when they were 18 years old?
You know, it would depend on how long they were in care, so, I think we could look at some things and maybe give you some estimates of that. I don't know that I have that with me today, but again, it would vary based on, how long they were in our care, if they came in maybe as a teenager, or if they were in our care longer, so.
Senator Petty, please.
Laura, thank you. A couple of things. So I think it was the first item that you went over on the slide 3, that $4.7 million. Those are already incurred costs. And so that's the request of restoring those funds because those are already incurred costs.
That's correct. They're incurred or they may not all be entirely expended, but they're committed, contractually. So that's right. And again, it's 20% of the reappropriation. We had previously given up $7 million. This would still give up the remaining amounts, and we would keep 20% for those incurred costs.
Thank you. And then the other thing is that maybe I missed it, but it was brought up by the staff presentation about the two global amendments that were made to the budget concerning vacant positions and that 1.5 across the board cut. So did you refer to those? I just was wondering.
Sure. I didn't refer to those specifically as they were global items, but, certainly it would be my recommendation and preference that there not be those kinds of across-the-board cuts or sort of a global piece like that on the FTEs. Like on the salaries, we use a lot of, vacant positions to cover, the shrinkage rates that we have as an agency. And so we're concerned, mainly about, on that one, I think it's a little bit more about kind of how it's written or calculated. And I know there's conversations going on around that between the proviso and the bill that's out there. But what I would want to make sure is that amounts that are already being used to cover agency shrinkage are not counted, or we're really kind of double hit and in a really, really bad spot if we already have like 14% shrinkage and then we end up having to, I don't care if we have vacant positions that we don't need. I'm not concerned about that, but I don't want our shrinkage rate to have to go up any further than it already is. And on the 1.5% across the board, I think as you can see just from, my conversation about the reappropriations and some of the requests that we had made in the GBR that weren't funded, we have a lot of administrative demands that that, we had asked for additional funding for that we'll already have to find resource for. I mean, for example, the tool that we use for our virtual call center across the state to serve clients, some other administrative operating expenses where costs have gone up. The governor had put some money in. The House did not fund that. I haven't asked you for that, but if you take an additional 1.5%, you're going to really exacerbate that even further because we're already would be short on the administrative side, $2 or $3 million that we already need to find ways to support, so.
And just as a follow-up on that, I know it's been a few years, but we were really committed to social workers and that you hadn't had, that you'd had a shortage of and being able to work with youth. And so when it looks at these vacant positions, is that still a position that changes quite often? And if there's no guardrails on that it could become a real issue?
Yeah, thank you, Sandra. I mean, that's correct. And we do continue to have high turnover with regard to social workers or positions like social workers who do that really hard work in child protection. And we also have, fairly high turnover rates also as well with some of our benefit specialists who are working with clients every day. So that's kind of why I made the reference to, to shrinkage. I just want to make sure that there's not some untoward consequence from trying to square up like vacant positions because we already, again, have to hold a lot of positions open for shrinkage. And I wouldn't like the fact that every time we have a person leave that we need, to do that critical protection work, that something would then happen to that and we wouldn't be able to backfill it.
Thank you.
Other questions? Senator Erickson.
Thank you, Mr. Chair. Thank you, Secretary, for your presentation. Just a question on the summer EBT program. That replaces the pandemic EBT program, if I understand correctly, for when schools and child care facilities were closed. That's what created the need for that. So now that we're past that, is the need, are child care centers still closed? And I know in Wichita, we have all kinds of summer programs. Schools provide lunch for children and their families and all through the summer. So I'm just trying to see the need that it sprung from and what the need still is there.
Yeah, thank you, Sandra. That's a great question because you're correct. During the pandemic, when things were closed, there was a lot of additional funding put in this regard, and there was kind of a summer program funding during that time. Subsequently, Congress enacted a permanent summer program to add on to the existing food assistance program that we already administer. So Congress decided to continue the summer program as a permanent program. I think we have a lot of data in the state, and you can look at kids count and things like that, looking at issues of food insecurity. So I think, from my perspective, yes, there is a need. It's a modest amount of resource that would go out to those families that rely on free and reduced lunch. But you're correct. There are other things out there. There are other food programs run through the Department of Education that are also through the USDA. But both of these are through the USDA, where you'll see things, as you said, at schools, could be at child care centers, might be outside of a school where there's food provided 2 days a week or 3 days a week. So this supplements that, but it is a new federal benefit program. The federal government's paying the entire cost of the benefits. The cost to the state is the administrative cost of managing it. So again, it's one more tool in addressing hunger and insecurity, and again, was a congressional proposal that passed a couple years ago to make it permanent.
Other questions? Seeing none. Thank you, Secretary.
Thank you. Thank you for the opportunity.
Next, we'll have the Kansas Department of Health and Environment Health Staff Overview with Megan Leopold, KLRD. Megan, welcome to committee.
Thank you, Mr. Chairman. Good morning. Megan Leopold with KLRD. I'll be going over the KDHE health budget, and that is on volume 2, page 313. And while you find that page, I will mention that KDHE has several staff members here, including Secretary Stanek, that can answer committee questions about both public health and healthcare finance. All right, I'm going to start on page 314. You can see that the agency's 2025 request was a decrease of $12.9 million below their approved amount. On the table, it's called Figure 4, it says budget analysis above it. I'm going to briefly walk you through items 1 through 6. This includes the reappropriations as well as the supplemental requests that the agency made in their budget request. For number 1, you can see that KDHE did have $63.4 million carried over in reappropriations from fiscal year 24 into fiscal year 25. The primary sources of those were caseloads carryovers as well as SGF from the Children's Health Insurance Program. Both of these were lapsed. The first is part of the caseloads process and the second by the agency in their budget request. The LBC recommendation then deleted an additional $15.6 million in these reappropriations. These included several different items, but then in the House recommendation, so in House Bill 2007, 2 of those were restored. The one for the pregnancy maintenance initiative, that's $253,000, as well as $9.1 million SGF for FMAP savings. These are SGF savings that were created due to the federal government paying a larger share for the Medicaid program, and the federal government will claw back these dollars if they are not used in the way that they are intended to be used, which is towards the HCBS program. Number 3, this will start the agency's supplemental request for fiscal year 25. The agency requested $2 million SGF, and that's for health facility surveys. The agency has had a difficult time staffing this program. This is a program that oversees the licensing and compliance with health and safety regulations for all continuing healthcare providers. These include specialty hospitals, critical access hospitals, home health agencies, and a variety of other entities. The agency is, because of the staffing shortages that really began with the COVID pandemic, they've fallen behind in keeping up with the federal regulations. They are currently on a corrective action plan with CMS, which is the federal Medicaid program, and they are asking for this funding to help create staffing conditions that will allow them to continue to make progress towards meeting federal guidelines. This supplemental was not recommended by the governor in her recommendation, and it is also not included in House Bill 2007. Number 4 is a gainwell contract increase. The agency is requesting $16.2 million, $4.8 million SGF. This is for the gainwell contract. This is the fiscal agent and contractor for the Kansas Medicaid modular system. This is the system that oversees the provider claims, prior authorizations, and other a lot of the moving parts of the Medicaid system. It's a very complex system. The contract was originally procured in 2015, and since that time, the system has undergone quite a modernization. It's grown quite a bit in order to keep up with federal regulations and through that modernization process. So the agency is asking for increased expenditures for the contract. For staff, that would be about $8.3 million, and then $7.9 million for technical support. The governor did recommend funding this supplemental in her recommendation, and the House did not include it in House Bill 2007. The next supplemental request for 2025 is for the EPASR. This is an electronic pre-admission screening. This is a program that provides individuals with information on long-term care options. It also assesses those diagnosed with intellectual and developmental disabilities for services that might benefit them. This is a one-time implementation costs of $4 million are included in this request, and ongoing costs would be lower than that, closer to 2 million SGF, or 2 million all funds and 500,000 SGF. The governor did not recommend this for fiscal year, I don't think that's right. The governor did recommend this. My notes were incorrect. The governor did recommend funding this for fiscal year 25. The House did not recommend funding this for 2025. One note on this is that there is a decrease in the KDAD's governor recommendation. This really is not starting a new program. It's really moving it from KDAD's to KDHE. And so if in the governor's recommendation, there was an addition for this supplemental request in KDHE, and then there is a subsequent deletion in KDAD's budget. Number 6, the agency they are asking for 16,000 SGF, and that's to upgrade 2 current entry-level epidemiologist positions to senior epidemiologists. And this was not recommended by the governor in her recommendation, and it is also not included in House Bill 2007. All right, I'm going to move to the green sheet that you have on page 13. This is the shorthand, so these are the items that the House has included in House Bill 2007 that were not included in the LBC request. The first is that reinstating that reappropriation lapse for the $9 million for the FMAP savings. On the next page, page 14, there is also an addition of that reinstatement of the lapse for the Pregnancy Maintenance Initiative. And then the final change for 2025 is that the LBC recommendation in a global motion deleted all of the increased FTEs in the agency's budget request, which was 46.9. The House then made a motion, and it is included in House Bill 2007, to reinstate 30 of those positions. And these positions are completely funded through federal funds. Those were the House changes for fiscal year 25. And then if you look at the yellow governor sheet, for fiscal year 25, you can see that the governor did recommend the electronic pre-admission screening and resident review. The governor did recommend the enhancement request for Gainwell contract increase. Neither of those enhancements or supplements are included in the House Bill 2007. The governor did not delete any of the FTE positions. There was a recommendation to add 51,000 for HIV testing. This was a correction. And an HCAP interest transfer, I'll get to that in fiscal year 26, is included in House Bill 2007, but it is included in fiscal year 26 rather than fiscal year 25. And I'm happy to see him for any questions for fiscal year 25.
Questions for 25? Senator Fagg.
Thank you, Mr. Chairman. I was wanting to talk a little bit about that Gainwell contract increase. If we didn't do that, we're under contract, aren't we, for 2 or 3 years? Or how long is that contract set up for? Is that renewed annually, or how does that work?
I don't know when the renewal is, but it was originally procured in 2015.
Okay, so it'd be interesting what kind of commitment we're into this, and if we just back off of it, what that's going to cost us is what I'm questioning on that part. So if you find that out for me, I appreciate it.
I think that's something that the agency could certainly speak to.
Other questions? Seeing none, Megan, thank you.
All right, I'm going to move forward now to page 320. (320) starts the fiscal year 26 analysis. Figure 7 shows the list of the budget request. And as before, I'll go through the enhancement requests. The first enhancement request is for $1 million SGF, and that's for IT security upgrades. This request was not included in the governor's recommendation, nor is it included in House Bill 2007. Second, the health facility inspections. This is a continuation of the request from fiscal year 25. Again, it's for $2 million SGF. These are the facility inspections that the agency is working to get back on track with their federally mandated guidelines. They're requesting this funding to help add additional staff to the program. The governor did recommend this enhancement request for fiscal year 26, and the House bill does not include this request. For number 3, the agency requested $2.3 million SGF. This is to continue infectious disease prevention and control through the Bureau of Disease Control and Prevention. These are funds that had been funded through federal grants. However, as part of the federal debt ceiling agreement in June of 2023, these federal funds were rescinded. The agency is asking for these funds to continue that work as planned. The governor partially recommended this by funding it with $1.5 million, and the House did not include funding for this in their request or in their bill. On the next page is the epidemiology staffing. This is a continuation from fiscal year 25 to upgrade current entry-level epidemiologist positions. The governor did not recommend this enhancement request, and the House did not include it in House Bill 2007. Number 6, the agency is requesting $504,000 SGF and 5 FTE positions. This is to fund workforce development and increase coordination between local health departments and the agency. The governor did not recommend this request, and the House did not include it in House Bill 2007. Number 6 is a continuation of the EPASR assessment tool. This is for $2 million. That includes $500,000 SGF. This is for operational costs, for ongoing costs for the system. The governor did recommend this, and again, there are corresponding deletions in the KDADS program, and the House did not include this in 2007. The Gainwell contract increase, again, a continuation for $16.7 million, including $5 million SGF for fiscal year 26. The governor did recommend including this enhancement in the budget. The House Bill 2007 does not include this funding. Number 8, the agency is requesting $12.9 million, including $1.5 million SGF. This is to implement a Medicaid provider centralized credentialing module. Right now, this process is fragmented between the different MCOs. This would centralize it, creating centralized information input from providers, as well as reducing time and effort on the MCOs throughout the credentialing process. This includes $11.5 million in one-time implementation expenditures. So outgoing years would be closer to $3 million all funds. And that is approximately $500,000 SGF. This is matched at a higher federal matching rate because of the type of program it is. The governor did recommend funding the provider credentialing enhancement request. The House did not include it in House Bill 2007. And finally, the last enhancement request for 26 are partial hospital services. The agency requested $1.5 million. This is to provide behavioral health partial hospital services. This is a new program that is a billing code that is not included in the current Medicaid program for a program that is expected to open at Children's Mercy Hospital. The governor did not recommend funding this in the agency's budget, and it is not included in House Bill 2007. All right, I will now call your attention to the green sheet again for fiscal year 26. KDHE fiscal year 26 changes start on page 14. These are the changes that the House made to the LBC recommendation. The first is to add $10 million for adult inpatient behavioral health. This is an addition that was made in last year's budget bill as well. This $10 million would be allocated out to 6 different hospitals, and it would be distributed based on the number of adult behavioral beds that are available at each facility. The House added $10 million, that includes $4 million SGF to increase Medicaid dental rates. They also included language directing the agency to collect data on the changes that they see in provider enrollment and utilization based on that change, based on the increased rates. The House added $2.7 million, and that includes $1 million SGF. This is to increase Medicaid reimbursement rates for sick and acute pediatric visits. They added $1.9 million, including $700,000 SGF to increase the rate for the dentistry code G0330. This is a facility fee. This is a recommendation that came out of the Sedation Dentistry Interim Committee. And that would increase the code payment from $1,700 to $2,500. The House added $550,000 for specialty healthcare clinics. These are 3 healthcare clinics that provide specialty healthcare on a volunteer basis. They added $1.1 million, including $420,000 SGF, and that's to raise the rate for vagus nerve implants and reimplants. They added $263,000 for cerebral palsy research. This would go to the Cerebral Palsy Research Foundation of Kansas and Wichita. They added $632,000, including $242,000 SGF, and language instructing the agency to implement the billing code to allow for reimbursement for assessment and care planning for Alzheimer's patients. They added $215,000, including $82,000 SGF, and also language requiring that the state Medicaid program provide reimbursement for diagnostic evaluations and preventative maintenance, as well as eliminating the requirement of prior authorization for these services or the repair of complex wheelchairs for fiscal year 26. They added $55,000 SGF for donated dental services program. On the next page, page 15, the House added $1 million, all from the ARPA interest funds, for a healthcare upskilling training program. This was deleted in the global deletion made by the Senate. The House reinstated those 30 FTE positions that were funded entirely with federal funds for fiscal year 26 as well. Number 13, the House added language directing the agency to raise the protected income level for the medically needy population to 100% of Social Security income. And they are instructing the agency to use existing resources to fund this. They added language requiring the agency adhere to MCO contracts as originally agreed upon for fiscal year 26. The House added language that interest earnings attributable to the SGF credit to the HCAP fund will be transferred. There are 3 different items for the HCAP, which is the Healthcare Access Improvement Program. Number 15, 17, and 18. 15 and 18 are both dealing with interest. There's an SGF credit that is provided to the account to help with cash flow purposes, and then it is removed from the account once it is no longer needed at the end of the fiscal year. That had been accruing interest while in the account. And so there is language, number 18, to transfer $8.7 million in interest from the HCAP account back to the SGF. And that is the interest that accrued in fiscal years 23 and 24. And that would occur in fiscal year 26. Then there is language that is being added that will do the same thing for the interest that's accrued in fiscal year 25. And then also adding language that in the future transfers will not include that interest, the estimated accrual of interest, so that these transfers will not need to be made in the future. And then the other change for the HCAP program, number 17, is adding language that requires critical access hospitals and rural emergency hospitals to participate in the provider assessment payment. And that is starting in fiscal year 26. And in order to, there's also language that in order to be required to do this, they must meet an annual revenue that is determined by a healthcare access improvement panel. Going back to number 16, the House is adding language to add 2 additional tests to the newborn screening program for fiscal year 26. And then last is childcare health and safety grants. Much like Amanda spoke about in DCF, this is another program that was originally funded using CIF funds. Because of the diminishing balance in the Key Fund and the CIF fund, the Children's Cabinet has recommended that they no longer be funded through the CIF. The governor recommended that these be funded with SGF. The House removed the funding from the CIF, but did not add SGF. And finally, I will move to the yellow page. Most of this I think I've already been through. But quickly going down, you can see that the governor did recommend the enhancement request for health facility surveys, for the electronic pre-admission screening, for the Gainwell contract increase, for the provider credentialing module, and did not delete any of the FTE positions. The governor also partially funded the enhancement request for disease control and prevention. The governor added SGF to fund the child care health and safety grants rather than funding it through CIF. The governor recommended $797.8 million all funds to fund Medicaid expansion, and that includes a deletion of $78.3 million SGF. And then finally is the HCAP interest calculation and transfer that was adopted by the House in House Bill 2007. And with that, I'm happy to stand for any questions.
Thank you, Megan. You said that last one, number 9, is in the House's position, right? Okay.
Yes.
Thank you. Questions? Seeing none. Thank you, Megan. Good job. Next, we'll have agency presentation. We'll have Secretary Janet Stankey. Welcome, committee.
Thank you. Thank you. Sorry, thank you. You have one document that summarizes what I'll speak to, and we have a number of people here from our leadership team that can help me out, help you out if you have questions that I can't answer. We have another budget book as well that summarizes the entire agency, public health and Medicaid. Environment is done separately. So I'll start with a request for reconsideration, which is what I'll title my presentation on. We have had 4 lapses that we are respectfully requested to get put back in the budget. 2 of those involve our new lab. One is the additional rent, which is increased because of our new lab and our relocation from the Forbes location of $1.386 million. We would normally budget rent anyways. This was a product of timing, not knowing exactly what we were going to be needing to pay. We are closer now, and we know that, and we are asking that get put back in. The second is $429,000 plus for new lab equipment. We did not have that to the amount. It's a timing thing, is why it's showing up now. We aren't relocated totally yet. This lab equipment is sensitive. It needs calibration by vendors and so forth, as you know. We didn't want to risk relocating ahead of the move and moving twice. So we are asking that be put back as well. The third is a child care pilot program. Money for $2.5 million had already been expended. This is for the joint venture Blue Cross and State of Kansas Child Care Center that will go live in '26. Again, this is a matter of timing. And then the fourth lapse is a Medicaid data warehouse project that had already been started. This is a $12 million roughly project, 1.4 million SGF, because we get 90% match dollars from the feds on this. This has already started. Having a strong data warehouse is important to the Medicaid program. This will result in efficiencies and meet stakeholder demands to have more visibility into CanCare data. Should we not get this money, the contract with the vendor, McKinsey, would be lapsed, as well as we would stop dead in our tracks on the progress that we've made, and we would be no further in meeting our objective. I'd like to move on to public health. The surveys Megan referred to, they're a life safety issue. I was a hospital administrator for 38 years before I joined the state, and I would tell you that these surveys are very detrimental to making sure that our patients and families in the state of Kansas are being taken care of in a safe manner. We have been underfunded and have not been able to meet the obligations to do safety surveys to the level we need to. We are respectfully asking that that get put back in our budget. We also have the disease investigation, which is the bureau that would go out and investigate communicable diseases like syphilis, HIV, et cetera. We are short 1.5 million in 2026, and we are asking for that money to be put back in the budget so we can continue to provide those services. And again, it's a safety issue. In the Medicaid program, Gainwell, the system, the central nervous system, fiscal intermediary of the Medicaid program, this is how the system works. We need 4.8 million SGF in 25 put back in, and 5 million in 26. The changes that we make every time the legislature or we get something approved for a new program, or you approve rate adjustments or whatever, these changes need to be made to the system. The federal government also has timing requirements. They need to be made per the federal CMS regulations. Not getting the system upgrades and being able to manipulate the system and reprogram data and so forth will result in a slowdown and stoppage in some cases of the Medicaid program. So this is just a cost of doing business request. And again, we get match dollars for this as well. And then the provider credentialing, the centralized, right now, this was a requirement of the new CanCare 3.0 contracts. This allows providers to apply one time in the credentialing system and be able to get approved for all three MCO insurance companies. So basically, this is an attraction meant to be an attraction to reduce administrative simplification for providers who apply to be in the Medicaid program, but also to make it more attractive to get more providers to want to take Medicaid patients. So this was a result of not just KDHE, but a number of stakeholders that weighed in to the MCO contract development, and I'll stop there. These are our priorities. We know there were other things, but we appreciate your reconsideration, and I'll take questions along with my staff. Thank you.
Thank you. Questions? Senator Holscher.
Thank you. I have a couple of different questions, if I may.
Go ahead.
The first one is in regard to the child care pilot. I think you said this goes live in 2026, so my understanding is this is essentially very much in the process. What would we lose if we don't fund that, I guess is my basic question there.
We would need to replenish that money without funds, and I'll turn to Secretary Profits here as well if he wants to weigh in on this.
Because essentially, I guess it says here the funding is no longer available for lapsing. I mean, that's the heart of it.
Because it's been expended.
Yeah, okay.
It was a timing thing, I guess is my point.
Gotcha, okay. My next question is in regard to the health facility surveys. Help me understand why those are of critical importance.
Okay, because we send, per CMS, we have to go out and survey facilities for safety. And we do hospitals and some other miscellaneous home health care, things like that, birthing centers. KDADS does nursing homes. So they have a sister arm to this. It is a safety matter because right now, and you've probably seen, for example, there have been about 3 major press releases on hospitals, one particularly large in Kansas, that have had some serious, serious issues with patient safety, including death. And we go in along with CMS, depending, sometimes CMS sends their own people in correlation with CMS, and we have to go in and make sure that all the regulatory requirements, and they're vast and voluminous, are being followed, from infection control to patient identification protocols to surgical protocols, et cetera. And that's what we do. We are short on doing that because we don't have enough staff. We've been kind of, right now, the prioritize or triaging those that are patient complaint surveys first. There's a whole process to do these on a regular cadence and whatnot that we're not able to keep up with.
Thank you.
Other questions, Senator Petty?
Thank you, Mr. Chairman. On the 1.5 for the disease investigation, you have listed there like HIV, syphilis. Does this also include tuberculosis?
It does, doesn't it? It could, yes.
How about measles?
Yes, so all of those, sorry. I just want to make sure because we didn't list them for you because we have different branches. Yes, correct.
Right. And so I know if you, I guess I should ask. So if there's a major outbreak, does CMS also come in with funds as well?
CDC sometimes does, but right now those funds have been cut. And staffing has, although we hear the government federals did hire some of those people back, but we don't know so far if that impacts Kansas. And CDC does, yes, support us.
So at this point in time,
These have been cut.
these have been cut.
Not because they were cut before, as we did the budget. It doesn't have to do with the current happenings of the feds.
But if we had, like in my own community, if we have a
Outbreak.
problem, an outbreak, then you're saying that now, this lack of funds wouldn't help that either, but also those CDC funds at this point are unclear, as you're saying that?
Are they what?
The CDC funds that would help with disease investigation have also been.
They've been relinquished.
Interesting. And then you've told us a lot about the Gainwell technology. I want to look back on the lapses. So those particular funds on the lapses concerning the lab and the lab equipment, have those been expended already? Or those are in the process of being expended? Which is that?
I'm going to turn to my CFO. I believe they're in the process of being expended. Yeah, they're in the process. Those are in the process.
So they're committed funds? Would that be correct that they are already committed for those rent and the search?
Rent for sure. The equipment, it depends on where they are with placing the order and whatnot. So I can't speak to that one, but I don't know if anyone, correct? Are they in process? The lab equipment? Yes, they are all in process.
So without these funds, will this then delay this whole process here?
Yes.
Okay, thanks.
Other questions? I guess I would ask you on this contract with Gainwell. That's a contract. When was that signed? The new contract? Didn't you just have a new contract, or is just an?
I'm going to turn to Christine Osterlund. Do we know the renewal terms on that?
So the original contract was signed in 2017. We went out for bid in 2015. This was the new modular systems that were required by CMS. Those modular systems started going live in 19 through 22. CMS gave us approval. Typically, you have a 10-year contract period because of the last implementation being 2022. The CMS gave us a permission to extend the current contract to 2029. So we renegotiated at the end of '24 with Gainwell to reflect, because they bid on a proposal that was put out in 2015. And of course, the Medicaid program looks very different today than it did in 2015, and what their requirements are and what they have to support looks very different. So this is a 4% increase of the contract value. That's what that dollar amount represents.
So it is a new contract.
It's an extension of a contract, yeah.
Yeah. So the new contract required $4.8 million more. Right, okay. And that was signed in '24?
At
said
the end of, the amendment is actually with CMS now.
Yeah, when did you sign your additional years to Gainwell?
So we have signed, and Gainwell has signed at the end of 2024, and then it goes to CMS for a final approval.
Okay, so it's 2024. It's a new contract in 2024. I mean, you're extending, but it's new. This 4.8 is new money, correct?
Yes.
Okay. Other questions? Senator Holscher.
Thank you. Actually, my question probably needs to go to Adam. I would just kind of like to circle back in regard to that child care pilot. You gave the timing issue as far as the impact to what you do, but I'm kind of curious about the operational aspect, if that's okay.
Yes, Adam, please come forward.
Thank you, Mr. Chair, and thank you for the question, Senator. For the record, Adam Proffitt, Secretary of Administration. The $2.5 million in question is money that was appropriated at KDHE a couple of years ago for the purposes of engaging in a child care pilot, a public-private partnership. It's been in the budget for a couple of years. Quite honestly, we've been negotiating with Blue Cross Blue Shield for a little over a year. I've been involved in those negotiations to develop a child care partnership. We came to an agreement on what that structure would look like. They have an existing elementary school building, old elementary school building on their campus. So we agreed that we would enter into a partnership whereby they would convert that facility from an old elementary school into a child care facility. And the only people that can utilize that are state of Kansas employees and their children, and Blue Cross Blue Shield employees and their children. Part of that agreement was for us to provide $2.5 million for the renovation costs. Again, that was appropriated to KDHE for those purposes. This is money that was reappropriated from '24 into '25. Because we had a legal authority on that appropriation for that purpose, we went ahead and signed the agreement. We sent the money to Blue Cross Blue Shield to do that. It's also worth noting that there will be no additional operational costs that the state is going to carry. This will be a self-sufficient child care facility, again, specific to Blue Cross Blue Shield employees and state of Kansas employees. So that's when the Secretary mentions timing, it took a little bit of time to, dot the i's and cross the t's on the agreement. We did that, we spent the money, and then after we spent the money behind that, the House did the lapses of the reappropriations.
You said the money is already gone?
Yes, we sent the money to Blue Cross Blue Shield back in late fall 2024.
So there's no money to lapse?
That's correct, but leaving the section in the budget bill that lapses the funding is problematic, because then that would leave a deficiency in the balance of KDHE. So we're asking to have that section stricken, which reinstates that lapse.
Senator Holscher.
And just to follow up on that, so not fulfilling it then, I guess, causes issues in terms of that partnership that has taken time to establish to put this whole plan in place?
Mr. Chair, if I may, yes, if the lapse is not restored, one of two things happens. One, we're negative $2.5 million, and we can't be negative in a state general fund account at the end of a fiscal year. Or I have to go back to Blue Cross Blue Shield and say, I appreciate all the time that we spent on this and appreciate that you've already moved forward, but we're going to exit this partnership. And I think that's a bad look for the state of Kansas, quite honestly. And I don't want to give a firm number, but in the neighborhood of 60 to 70 child care slots that would be available for state of Kansas employees, again, self-sufficient, not funded by the state, would be gone.
Other questions? Seeing none, thank you, Adam. Was there any other questions for Secretary Stanky? Seeing none, we'll close our hearing. Secretary.
Thank you very much for your reconsideration.
Yes, and thank you for being here today. Appreciate everybody. Committee also point out that you have pretty good-sized packet of written-only testimony. And with that, we are.